Welcome to the Flower Empowered. We have a live Q&A starting just now, and we have a couple of questions that are left over from last week. Unfortunately, I wasn't viewing the comments correctly, so this is live both on YouTube and Facebook, but last week I was only seeing the YouTube comments. So this week I hope to fix that. Only I can't see any of the comments right now. Let's see, show chat. There we go. So we have three questions from last week that are relating to pelvic organ prolapse, incontinence, and the use of pessaries. And so they're all connected, these questions. So I thought I would start by going through those questions. And then if you have a specific question or if something that I say isn't clear to you, you can just add your message in the comments section. And I will hopefully see that if I'm looking properly. I will hopefully see that popping up on my chat stream here. So I'm going to start with a question from Mary, who was on YouTube, and she asked, with both POP and incontinence, what are the steps to regain continence and to safely return to running and other active sports? So when it comes to pelvic floor dysfunction, and pelvic organ prolapse and incontinence are two symptoms of pelvic organ prolapse. So two symptoms of pelvic floor dysfunction. So when it comes to pelvic floor dysfunction, I always like to start with removing tension. Now, it can seem a little counterproductive to remove tension if you have incontinence. You might think, oh, but I need to kind of hold more. Or if you have pelvic organ prolapse, you might be worried that removing tension is going to make things a little bit more lax and that things might fall out. That's not the case. So the first thing you should do, and the first thing I always advise people to do, is to practice yoga nidra. Now, I put a yoga nidra video on the channel yesterday, so I would suggest that you start there. You have to start with getting the nervous system to come to a calm and centered place. The rested state is what I like to call it. So if you can get everything to calm down a little, and if you can get excess tension out of the system by first relaxing, that's the great starting point. Now, from there, you should look to your pelvic floor and see, well, what is and isn't responding within my pelvic floor. Now, I have a video on the channel that takes you through all of the different steps. So usually I break the pelvic floor exercise into 6 different steps, and then if the 7th step is the full contraction. So by practicing in this way, by starting with a mind to muscle connection, sorry, my phone is buzzing. I'm not sure how to stop it from buzzing. It's comments coming in. So when you start by taking breaking the pelvic floor contraction down into steps, you'll very quickly see if parts of your pelvic floor aren't responding as well to your mind's connection, when your mind is asking for that part of the pelvic floor to contract. You don't start with big, strong contractions. You shouldn't be looking to do maximum strength contractions to start. A maximum strength contraction will also contract other muscles, and that is not where you want to begin. So begin by breaking your pelvic floor exercise down into the different steps. You can, if you find that a part of your pelvic floor isn't contracting when you try to contract it, you can put your finger on that part of the pelvic floor, just gently touch. That touch sends a signal to your brain, and it helps your mind to reach that muscle so that you can create the contraction. And by practicing in this way, you start to get everything moving just a little. So it's gentle movement, it's gentle contraction, it's not anything hard. Initially, you practice the contractions on the exhalation, and we do this because already there is some lift coming into the pelvic floor when you exhale due to the relationship between the pelvic floor and the diaphragm. So once you have started to get all of the different parts of the pelvic floor coming together, you can start to do full pelvic floor contractions. And the contract and release is where you start when you get your full contraction. So there is a video on the channel for control, so 20 minutes for pelvic floor control, where you build up your pelvic floor exercise using all the different parts, and then you start to contract and release on the exhalation. So if you practice that, that starts to get everything working, and it starts to build a little bit of contractility into the pelvic floor. From there, you can work on endurance, and this is where you start to learn to hold your pelvic floor contractions. Now, you're still not going for super strong. You don't want to be straining your face or crunching your abs when you're doing it. You don't want to be squeezing your glutes. It's just the pelvic floor. So it's still not the world's strongest contraction. So you get your endurance. It's a hold. It's like I discussed last week, like imagining that you can hold all day. That's what you're looking to achieve, that level of control where you can take a contraction and you can hold it for a minute, 2 minutes, 3 minutes. Eventually, you get a contraction that you can maintain for a long period of time. And then you don't have to hold anymore because the pelvic floor tone increases, and there's an ability already, just due to the increase in the length tension. So you actually make it so that it's a little bit stronger, and then it holds naturally by itself. From there, you work on speed. So that's where you do contract, release, contract, release, contract, release. So quick flick contractions. And that helps to work the fast twitch fibers. Now, they can't respond for very long because they use a lot of energy when you do those strong contract and releases. So, and you want to be able to do a lot of them. You want to be able to contract fully, relax fully in each of those contractions. From there, you move on to doing what I like to call max strength Kegels. So this is where you're going to contract fully. Actually, before you do that, it's good to do the co-contraction. So there's a video on the channel that shows you how to create a co-contraction between the abdominals and the pelvic floor. Now, this is that gentle contraction. It's like an RPE4 on the rate of perceived effort scale for pelvic floor contractions that I'll show. I'll put a little link to a video for that when this when this video is put out a little later. But the contractions need to be I have a question, but the contractions need to be a little bit, you maintain like a level 4, and then you contract stronger when you do max strength contractions. But before you can do that, you need to be able to do a co-contraction. And the reason for this is because when you do a maximum strength contraction, you will contract other muscles. So a maximum pelvic floor contraction will recruit abs. It will sometimes also recruit a little bit of the other muscles, maybe sometimes the adductors or the glutes or other muscles can fire as well, just due to the force of that contraction. So if you do the co-contractions, learn to walk about and to move with a gentle co-contraction, then move on to doing maximum strength contractions. And then also practice your different pelvic floor exercises in different positions. So if you only ever do them lying down or sitting, then you'll have a great strong pelvic floor lying down or sitting, but that isn't going to carry to when you actually have to get up and move about. And then what can happen is that you can have a stress incontinence episode because you're up and doing something that your pelvic floor hasn't trained for. So you can actually train a pelvic floor that is very dysfunctional to regain function, and then you can train your pelvic floor to be able to manage things like running, like lifting weights, like jumping. Now, that's a little bit the pelvic floor control. We talked a little there about co-contraction between the pelvic floor and the abdominals. Now, this is part of the work that you need to do to begin to manage and balance intra-abdominal pressure, which is very important when it comes to pelvic organ prolapse. So pelvic organ prolapse I talked about last week. Now, there was an issue with the video where the sound disappeared when I was showing a diagram. So if you've ever seen a diagram of a pelvic organ prolapse, it looks like there's a big bulge. But the thing that isn't very often explained is that bulge is when the tissues are under pressure. So it's when there is an excessive load of downward pressure and there is a point of least resistance. That is where the prolapse is. Now, you can make the prolapse better. Now, I don't mean make it disappear completely. If you have weakness in your tissue, there's a certain amount you can do to build strength. But really, when you have a prolapse, there is generally laxity that is not, you're not going to really be able to bring those tissues back to their original strength. But if there is excess tension in other parts of the tissues, so let's imagine, say, for example, that in the vaginal wall there is scar tissue, then that is going to make the prolapse a little worse. So you can go to a pelvic floor physiotherapist and have them actually release that scar tissue. And you can also have the muscles, if they're hypertonic, you can work to get a little bit of length to rebalance the length-tension relationship in the muscles. And that can help for everything to expand a little more when there is some downward pressure and you don't then have that same single point of failure. So that those are little things that you can do. But the main thing is to get the pelvic floor to create an upward resistance to the downward pressure, and then to get the abdominals also to brace along with the pelvic floor. So that work involves getting the abs to start to function together with the pelvic floor using these co-contractions, and then training the body in different positions, doing different exercises. Can sound a little bit overwhelming. There's a lot to do. I mean, this is why I have written a book about it, because there's so much. It's not... there's not just one thing that you're going to do, and there's not one exercise that's going to make everything better, or one device that you can buy that's going to make everything better. But if you train your pelvic floor, and if you gradually progressively overload tissues in a controlled way, you can learn to balance intra-abdominal pressures so that you're not blowing up your pop, you're not putting a lot of pressure on it. And you can also learn to be able to manage and maintain the urethral closure pressure so that you don't have urinary leakage. Now, I hope that was a little bit helpful. I do see a question here. Hello. In fact, the question that baffles me is whether the problem is in the prostate or in the pelvic floor muscles in relation to CPPS. Yeah, with chronic pelvic pain syndrome, CPPS, when we speak about men, there can be, even in women, when it comes to pelvic pain, it can be very difficult to actually pinpoint where the issue is. If you're a man, you will be sent by default to a urologist, and the urologist will look at the prostate first, because the prostate can cause pain. It can cause many different things. It can swell. It can put pressure on nerves. And it can also create urinary retention. So there's lots of different things that can happen around the prostate. Now, unfortunately, you do have to go to a urologist typically to have an investigation to see what is the cause of the pain. It's always very important with pelvic pain to rule out anything sinister. If you're a woman that has pelvic pain, you're probably going to be sent to a urogynecologist or a gynecologist or an OB/GYN, an obstetrician and gynecologist, and they will look to see, well, is there anything sinister here? And always important to check to see, is there something, is there some underlying disease or tissue pathology that needs to be looked at. But when it comes down to it being a pelvic floor dysfunction, where the pelvic floor muscles are hypertonic or hypotonic, then the dealing with that starts with looking at taking away the tension first, getting the mind to relax, releasing as much tension from the area as possible, and then doing the relaxation exercises. So there's quite a few relaxation exercises on the channel where we work to put a little bit of stretch on the tissues in different directions. And what that does is it helps to communicate to the nervous system to let go of the excess tension. And with consistency, that can help to relieve the pain. But it is important, particularly with the prostate, very important to get it checked and to make sure that there isn't something sinister going on. So we have a question here. What are some of the things I can do for vaginismus? So when it comes to vaginismus, again, that is a pelvic floor condition. So it's where the pelvic floor is going into a spasm when there is any attempt to put anything into the vaginal passage. And I mean, this can be right from the very beginning. It can be difficult to have any kind of penetration. So whether you're trying to put in a tampon or anything else for that matter, the same place to start is with the other pelvic floor dysfunctions. First, the reduction of tension, so taking tension out of the system, and that can be, first I would always start with emotional tension. So the yoga nidra helps to relax everything. It helps to get the body to a rested state, which is really important. As much as possible, you have to take away the tension. Also then doing the pelvic floor relaxation exercises. They gently move the tissues and communicate to the nervous system to let go of tension. And it is all initially about letting go of tension. Another thing that I advise everybody with pelvic floor dysfunction to do is to look at your thoughts around your pelvic floor dysfunction. It's very important to do, I like to do the work on the thoughts. So Byron Katie has some therapy. It's like a cognitive behavioral therapy where you ask some questions of your thoughts and you try to analyze, well, why do I believe this thought, and why is this having such an impact on me? This is what I did with my own pelvic floor dysfunction, to get to the root of the pelvic floor dysfunction. And there's a lot of taboo. A big part of this channel is trying to break taboo. And if we can get away from the taboos and all of the conditioning that placed these beliefs and thoughts in our minds, then it can be a little bit easier for the nervous system to let go of the tension. And that's what we really want, is to get the nervous system to let go of tension. Now for the vaginismus, I'm just going to... You can also use dilation. Now, I do have a video on the channel showing how to do dilation. So you need to make sure that the adductor muscles on the insides of the legs are relaxed, and you do that by putting pillows either sides of the legs. And then you can use dilators. So this is a dilator. It's a small dilator. It's just, you can see it's just a little bit bigger than a finger, and it's silicone, so it's quite soft. So you would need to use some sort of lubrication if you're going to try with dilators. And these typically come in a set where they get bigger and bigger. So you can work at, really, I would suggest that you do something like a yoga nidra to get the whole body to relax, that you practice in a place where you're propped up and comfortable. So use pillows and cushions and things as much as possible to support your body. The adductor muscles are like safety muscles. So they're the muscles on the insides of the legs, and they make the legs close. So you can work, if you run your fingers along the insides of the legs, you'll either get the sensation to close or not. And you'll know that you've relaxed the nervous system enough if when you run the fingers along the insides of the legs, you don't get that jolt to try and pull them closed. It's a little trick for kind of seeing if the nervous system feels safe. And once the nervous system feels safe, then with a well lubricated dilator, you can start to try to do some dilation. And with dilation, I would put the dilator in and out rather than just putting it in and leaving it in, which I know some people do advise to do. But it's better that you teach the spasming tends to happen on something going in. So by practicing multiple times with putting it in and out, your nervous system gets to experience that, and it takes a little bit of the fear away. So that would be my suggestion. Okay, let's see. We have lots of comments now. Claire is saying, hi, thank you so much for everything you do. Oh, you're welcome. I have hypertonic pelvic floor and have recently been diagnosed with multiple low-grade prolapses. I'm still working on relaxing my pelvic floor, but wondering if you could start any hip strengthening or glute strengthening. Okay, so Typically, where you have hypertonicity, you have to start with relaxation. And I know that there's always fear. Anybody that I speak to that has pelvic organ prolapse has this fear of relaxing and letting go. As I said, I'm not sure if you were here for the start. The first question was around pelvic organ prolapse. But when it comes to pelvic organ prolapse, the first thing that you need to do is take tension out of the system. And it can seem contradictory because you think, they give this idea that pelvic organ prolapse is things falling out, but that's not really the case. Pelvic organ prolapse is when there is excess intra-abdominal pressure that is finding the path of least resistance. And when you think about your prolapse, you maybe look at those diagrams on the internet and you see what a bulge looks like and you think, oh, that's it. But that bulge actually isn't always there. The bulge comes when there is excessive downward pressure. So the way to manage your pelvic organ prolapse, the first thing to do is to remove tension. So work on exercises that lengthen the tissues around the hips. Work on getting the pelvic floor to relax. And then it's okay to start adding some exercises for strength in, but start very gradually. So there's a video showing how to do the co-contraction between the abdominals and the pelvic floor. And that's where you want to start with getting that little group of muscles working together, because it's all about work. It's about getting everything to work together. It comes down to balance of tension and pressure. So what we want to do is to get all of the muscles doing a little bit of work. They all need to do a little. If one muscle group is overloaded, then somewhere there's going to be an imbalance. So it's very important that you get everything to work together. So there is a video on then, once you learn the co-contractions for the core and the pelvic floor, and you do the videos that work on getting your pelvic floor to start to regain a little bit of strength, and also the exercises for releasing the tension. Then you can start to look at there's a core video where you start to move away from just getting the co-contraction. You activate the core and then you do some gentle controlled exercises, and then you can do the same with the glutes. You can start on the hip exercises, I would say, because there you're moving a little into a different plane. So if you work first on the core, then on the glutes, after the pelvic floor, of course, and then start to try the hip exercises. But be very, very mindful as you go. Pay attention to what you feel in your body. Your body is always sending you signals telling you what is happening. So if you can listen to your body, and then if you add an exercise in and it makes you feel a little symptomatic or things feel a little bit worse, take that one away again and work at the level you were at before. So always start low and very gradually you build load on the system, and you try to work with rebalancing the body, should we say. So balancing tension through all of the different tissues and learning to manage the load. I hope that helps. I feel like I'm waffling now. Let's see. Desiree, thank you for the kind comment. Okay, I'm going to jump on to the next question from last week. So the first one from last week was about pelvic organ prolapse and incontinence, and I talked a little bit about it there. When you do all of these, like you use a graded exposure system to retrain the body, then you get to a stage where you can start to do sports again. But before you're doing sports, you need to have worked your way up to those max Kegel exercises. And then I always like to start doing those strong contractions from a co-contraction. So if you imagine that you contract your pelvic floor to a co-contraction, which is about it's about a rate of perceived effort of 4. It's like holding something in your hand all day, and then you go from there to maximum strength where you squeeze as hard as you can, and then you come back down to the 4. You don't go all the way to 0, and then you contract, and then you come down. So you do these in different static positions. So that starts to kind of train the body to be very strong in the pelvic floor, but in lots of different positions. I like to do it with yoga. So I practice yoga, and then in different static positions in yoga, as I exhale, I'll do my maximum strength contraction. But through the entire yoga practice, I will be holding the marble in my hand all day. I'll be holding that RPE 4 contraction of my pelvic floor and my lower abdominal. So that nice co-contraction. So then when it comes to running and kind of taking it to the next level, once you get to that max strength contraction level, then you have to start working on kind of dynamic functional stability of the pelvic floor. And this is where we start to do jumping and, you know, pulling and let's say very strong things. Like it is where you start to run again, for example, if you have been a runner and if you're interested in running. And then you have to do that also in a graded way. So you don't go from 0 to hero. You have to very gradually add on. And all the way along this journey, you have to be able to take a step back if needed. Now, in order to go from being completely incontinent, which is where I was with the pelvic organ prolapse, to being able to run, do any kind of strength training, jump, whatever. I mean, I did bodybuilding. To be able to go from there to there, you have to have a plan. You have to imagine that your end goal might be to run 10 kilometers or to, you know, lift 100 kilos. But you can't go from I'm completely incontinent and I have pelvic organ prolapse to I'm going to run 10 kilometers and lift 100 kilos without taking steps along the way. I like to think of it like your end goal is like a hamburger, but you have to break that down into bites so that each step along the way you get a little bit closer to having that whole burger, you know, in your belly. So you can choose your end goal and then reverse engineer your way back. This is one of the things that I cover in the book, how to do this, how to take, this is what I want to achieve, and this is where I'm going to come back to. If you've had children and let's say that childbirth has created a prolapse and incontinence and all of these things, and you decide, okay, my goal is to run a marathon, but you've never run a marathon before, then I would say to you, that's not the right goal. Your goal should be to return to something that your body was able to do before. And then once you get to that, once you have achieved that goal, then you can create a new goal. And then you do the same process, but it takes you further. So this is how I got to doing the bodybuilding. Once I regained my continence and I was back to doing the yoga and the running and all the things that I had done before, I thought, wow, you know, they told me when I was leaving the hospital, you'll never be able to lift anything heavier than a kettle of water ever again. But they also told me I would be incontinent for the rest of my life. And I proved that that wasn't true. And then I thought, well, I wonder if it's true about the kettle of water. I wonder if I can lift more. I wonder if I can get stronger. So I set myself a goal and I worked up and I got very strong. I mean, it blew my mind how much I was able to achieve. And I'm just a normal woman, just like we're all just normal humans. So we have this ability to ask our bodies and our nervous systems to help us to become stronger and to help us to achieve things, and we can get there. Okay, let's see. Desiree has a question for dilating for vaginismus. How long do you stay at one size of dilator before you move up? So this is completely down to you. So let's say that you start with the small dilator and this is really easy and no problem and you kind of feel like, yeah, this is good. Right away, try the next one. You don't have to wait until the next time. And the same thing goes. So let's say today you're able to go all the way to the big one and you think this is fantastic. And then you go tomorrow and the small one won't go in. You know, then you work at the smaller size. The body is constantly changing. And it's not just your movement that has an impact on it. Your stress levels have a massive impact on your body. The environment around you, can be chemical, physical, emotional stressors. It could be that you've done some movement. Maybe you've been lifting things at work, or maybe you've been to the gym, or you've done something and your body says, no, today it's a no for me. And then on another day, your body might say everything's a yes. I like to think of it like when I show up on my mat to do yoga. I stand on the mat and I show up for myself every day. Regardless of what's going to happen, I stand on the mat and I'm like, right, now I'm here. Some days it's a strong, long practice. I feel fantastic. Other days I'm going to stand there and I just want to lie down and have a savasana. I don't feel like doing any movement because the body isn't always the same. It is constantly changing. So always, don't think about which size, just think about meeting your body where you find it, and about accepting what you're meeting. So you accept and you say, okay, I like to think of my nervous system like a little friend that I take with me everywhere, and you say, okay, let's try this. And you give yourself a little hug, be really kind to yourself, and then say, okay, let's try the first one. And if that goes well, try the second one, etc. Eventually, your nervous system will be very comfortable with you and will feel very safe. And vaginismus is a protective response. Like all of these muscular contractions, these hypertonicities, are protective responses, as is the chronic pain that you get from CPPS or other pelvic floor dysfunctions where you have pain. They're all protective responses. And what we're trying to do is to get a message of safety through to the nervous system. And the more we can communicate safety, and we do that by letting go of tension, getting everything to relax, finding equanimity, finding the rested state, then the more we can do that, then the more the body will respond in a positive way, where eventually you don't have to think about what's going on in your body. Things just happen and things just work. Now the question, the next question was around, it was from Liz, and it was from Facebook last week, and she was asking, why are we told not to lift with POP, and what muscles do we need to train to be able to lift children, for example? So we're told not to lift things with POP because when you lift things, your body has to be able to balance the tension from that load. And usually that creates an increase in intra-abdominal pressure. Now, if you lift something that's very heavy and you're not used to it, then the intra-abdominal pressure will be excessive and you will bear down heavily on your pelvic floor. So the reason they say not to lift things is because that inability to control intra-abdominal pressure is going to put the pelvic organ prolapse under pressure. And the reason for that is because the pressure has to go somewhere. Pressure will always push on something. And when it pushes on the tissues of the body, it looks for the path of least resistance, and that is where you may get a bulge. And that's what your pelvic organ prolapse is. So the reason not to lift the heavy thing is because you can't manage the intra-abdominal pressure. But if you learn to manage the intra-abdominal pressure by first getting the tension out of the system, you can go to a pelvic floor physiotherapist. They can help to release scar tissues, fascial adhesions, etc. That basically creates a little bit more flexibility in the pelvic floor, so that when there is an increase in tension, it's not going to be focused on one single point. Instead, it's going to be a little bit more distributed and therefore less likely to create a bulge. That's the first thing. The next thing is to get the pelvic floor a little bit stronger so that it can resist with some counter pressure. So that puts a little bit of, let's say, it balances by putting a little pressure up. So that's the next thing. But then when it comes to being able to lift, say, a child or something heavy, you need to get a little strength in the pelvic floor. You need to get some strength in the core. You need to start to control the muscles together with co-contractions. And then you need to, as you start to lift, you need to use your body to lift. So there's a knack with lifting things. I mean, if you bend at your knees, for example, to squat down and pick something up, that will distribute the load more evenly through your body, versus if you bend, like if you flex from the hip and round your back to go forward and pick something up. If you do it that way, then the tension is going to land in a different place, and you can actually injure your back lifting that way. So there's safe practices for lifting. I will make a video on lifting so that to show you there's some safe practices. But then when it comes to lifting heavy things, you need to learn to brace the core. Now that goes a step further. So once you have a little bit of strength in the core and the pelvic floor, and you need to learn to control your breathing as well, because you want the diaphragm and the pelvic floor moving properly. So a big part of the book is teaching different breathing techniques to get the breathing muscles all to work properly, and to make sure that you're not using, for example, the shoulders to move the breath in and out of the body. This can happen. This is a dysfunctional breathing pattern. So once you get all of the different components, let's say, around the torso to work, you can brace the core, so you can actually hold the tension, the pressure inside that cavity in a nice way, and then use the muscles, like the big strong muscles on your legs and your glutes, for example, to pick things up from the floor. So you're not lifting things with your low back and your pelvic floor. You're lifting with your legs, and you're holding in a particular way so that you're able to manage the pressure and you're able to brace your core. So there's quite a lot to it, but once you learn, and once you learn gradually, then it becomes much easier. And the next question is from Isabel. This one came over email, and she asked, do pessaries aid rehabilitation from pelvic organ prolapse, or can they hinder progress and aggravate symptoms? So pessaries are, I would say, very useful if you're suffering from pelvic organ prolapse. Now, in some cases, like most women, I think it's 1 in every 2 women will have some form of prolapse, pelvic organ prolapse. And most people have some type of prolapse somewhere in their body. Now, that could be as small as a varicose vein, or it could be as large as a diastasis recti, where the linea alba separates right down the middle of the stomach. So it can be, the prolapses can be small or they can be large, and they can be in many different places. But having a prolapse is a hernia, and having a hernia or some sort of tissue weakness in some part of your body doesn't mean that you can't live a full and active life. Now, if you have a pelvic organ prolapse, then it can, if it's symptomatic, it can feel quite uncomfortable, because it can feel like you've got a golf ball or a tampon in your vagina, even though there's nothing there. It can feel like when you're moving, you're very aware. There's a lot of nerves in that area, so you can sense it a lot more than, say, a varicose vein, which you might never feel or never notice until someone points at it. But in order to try and alleviate the symptoms, if it's symptomatic, putting a pessary in creates a little bit of support. And you can do all of your pelvic floor exercises with that support in. And you can do like lifting and all these different things. Pessaries usually are fitted for a longer period of time. So if you go and have a pessary fitted, there's different types. So there are some that are supportive, so like a ring pessary that just you put it into the vagina and then it opens out, and it creates a little bit of support around the vaginal fornix, which is where the neck of the womb comes down, so it kind of sits around there, and that can actually provide quite a lot of relief from symptoms if you have, say, grade 3 prolapse. And then there's also space filling pessaries. Now, space filling pessaries they're a little bit larger, so they can be cubes, or there's lots of different shapes, and they're put in. But with these pessaries, they're a little more permanent, and they stay in usually for like 2-3 months. You might go every 2 months to get it taken out and cleaned, or if you're able to put it in and take it out yourself, then you can take it out and clean it more regularly. Sometimes these pessaries you can develop infections just simply because there's something in the vagina. So you might get BV, vaginosis. Sometimes, not all of the time, and sometimes they can irritate the skin a little bit. So it is a little bit, you have to work a little to change the size or to try a different shape if it's irritating you in any way. But it is very supportive. There's also pessaries, and I have some here. These are starter kits. So if you suffer from incontinence, these are like, they're single-use pessaries. So let me just show you one. They're all different sizes. So they look a little bit like a tampon, and they're quite hard, but you take them and you soak them in water, and then you put them into the vaginal passage like you would a tampon, and they provide a little bit of, they're like a space filling pessary. They provide a little bit of internal support. Now, if you suffer from stress incontinence, these can actually be helpful because they put a little bit of support against the urethra, and that sometimes can prevent leakage. And they come, these are 2 different starter kits, and they come in different sizes. So you can see this is a smaller one, this is a larger one. So they're 2 different sizes. And then there's also an even bigger kit. So you can see this is quite large. So these can be useful for if you're having some issues with pelvic organ prolapse or stress incontinence and you can't get a pessary fitted, then these can help as well. And it's, I would say, trial and error. Claire is asking, when will the book be available? Oh, it's a really good question. It's with the editor at the minute. She will have it for 6 weeks. Then it'll be back with me for probably 3 or 4 weeks. Back with the editor for the last edit. And then hopefully at the end of May, it will be out. That is the plan. And I didn't think it was going to take so long, but it was a lot of work. It's a big book. It has a whole... It's broken into 3 parts. So part 1 is knowledge, and it goes through all of the things that you need to know about your body in order that you kind of have the information you need in order to be able to tackle the problem. And then the next part is part 2 goes through what you need to do. So it shows you how to do self-assessments to see what's wrong, and it goes through all aspects. So it's not just looking at the pelvic floor. We look at the whole body, look at the mind, and then and the breathing, and then we break it down. So there's an exercise program in the book. I took some 700 and odd photos for it. So it's quite a big piece of work. The last part of the book goes through all of the different conditions. Explains what all the different treatments are, what type of specialists you would need to see, etc. So it's a big book. It was a lot of work, and yeah, hopefully May or June. That's what I'm hoping. I see there's also a question here from Abs. When I perform a reverse Kegel, sometimes it feels as if the rhythm is wrong. For example, when I breathe in, the pelvic floor goes up instead of down, and vice versa. So when you're doing a reverse Kegel, you have to, let's say, let the pelvic floor be. So just leave it there first and just let it hang out. And then when you're doing your inhalation and your exhalation, you should be just sensing on the inhalation that it's expanding a little, and on the exhalation you're still relaxing. You're not actually doing anything. So you don't bear down, you don't try to push, you don't try to send anything downwards. Now, if you're finding that there's a little bit of a lack of synergy in that movement and you feel like it's lifting up, if you feel like it's lifting up when it should be expanding a little, there's a couple of things you can do. So the first thing you can do is feel it with your hand, because sometimes what you're sensing and what's actually happening can be different. Just like somebody doing a pelvic floor contraction sometimes can be bearing down. So it's always important, whether you're doing a Kegel or a reverse Kegel, put your hand on your perineum. Do your Kegel or your reverse Kegel. When you do your Kegel, you should feel things lift up. When you do a reverse Kegel, you should feel things moving down. And it's slight. It's not big. Pelvic floor doesn't move massively. It moves just a little bit. The next thing that you want to look at is your breathing. So if you have a dysfunctional breathing pattern, then maybe your diaphragm isn't moving sufficiently to move the pelvic floor, in which case you need to do exercises to get your breathing functioning again. Now, one of the simple ones that I like to do just to check your breathing, and everybody can do this with me if you want. I'm just going to twist around. So if you just look, I'm just going to kind of slump a little bit. So I'm not sitting military straight. I'm just resting in the chair, and I'm not pressing my back into the chair. I'm just resting in the chair. I'm just going to let my head hang. Now my rib cage is depressed. My shoulders are relaxed. I'm just going to put this down just a little. So in this position, when I'm just relaxing, I'm just going to let my head hang, and I'm just going to allow myself to breathe naturally. Now, when you do this, you're taking all of these muscles, you're taking the SEM and the scalenes and the shoulders and the pecs all out of the equation. So when you allow your rib cage to depress in this position, and you allow yourself to relax in the chair, and you allow the head to hang, and let the breath happen naturally, you're taking all of the accessory muscles out of the equation. And if you feel panicky in that pose, if you feel panicky breathing that way when everything's just relaxed and you're just depressed in the rib cage, then your diaphragm isn't doing the breathing for you. And it's very likely that you've been using your like upper chest muscles to do the breathing. And if that's the case, that you need to work on getting your breathing functioning properly. Now, once the breathing starts to function properly and you start to get the rib cage to expand and contract in your when you're breathing, your pelvic floor will be more flexible because it will move more as the diaphragm moves more. And it can be good to do to try the hyperpressive exercises if that's what you're finding, and then see if that helps a little with your reverse Kegels. I hope that helps. Let's see, where are we? Laura asks, when I sit down, my pelvic floor moves forward and I need to urinate. Why do pelvic floor exercises not make it better? Not sure I understand the question. Laura, I don't really understand your question. Can you ask it a slightly different way, please? I'm sorry. When I sit down, let me see. I'm just going to scroll up and see, did I miss anyone here? Oh, there, Laura, you've asked it twice already. Let's see. When I sit down, my pelvic floor moves forward. So when you sit down, you're getting an urgency to urinate. I think that's what you're saying here. Okay. If you're getting an urgency to urinate every time you sit down, I would first look to see maybe if there's some tension around your hips. So when it comes to urgency incontinence, or overactive bladder as it's also known, the symptoms of that can be felt in certain positions, can also be felt if you're, say, putting the key in the door and then you get this urgent need to go. So this urgency sensation, it can come because of excess tension. So the first place, again, to start is with letting go of tension. So if you, yeah, that's great. That is it. So there's a Yoga Nidra video to help to do a body scanning meditation. Now, the Yoga Nidra body scan, the idea is that you move around the body looking for tension, and you're going to find tension in different places and you try to relax it. And that practice helps you to sense tension and to let it go. Then we have pelvic floor relaxation videos where you go into certain positions that stretch the tissues a little, going through the pelvic floor. And this also helps to release tension, because when you stretch tissues, there's reflex arcs that happen between tendon organs and muscles. So there's certain tendon organs that will inhibit muscular contractions. And if you have hypertonicity, sometimes doing different stretches will turn off the hypertonicity because of this reflexive action. So it's good to do some of those. The other thing to do then, when you get urgency, it's like your bladder is sending you a signal to say, I need to go. Okay, so there is on your external urethral sphincter, so the little sphincter muscle that closes your pee pipe, there's little nerves on it that are communicating back and forth, along with it basically communicates to get the bladder to relax. So if you contract the front part of your pelvic floor when you get that urgency sensation, that sends a signal back. It's part of the guarding reflex. It's a reflexive action. Sends a signal back to your nervous system to say, it's not time, I can't go yet. And that can actually trigger the bladder to relax. So when you get urgency, stop wherever you are, even if you're standing, if you're putting the key in the door, when you get urgency, stop, be really still, relax your pelvic floor, relax your lower abdominals, relax your body, and then contract just that front part of your pelvic floor. Nice strong squeeze, relax. And then again, and relax. And you repeat that maybe 10 times, and then go on about your business. And what you should find is that urgency, that like kind of sense of I really need to go, will calm down, because you're tapping into the guarding reflex. You're basically tricking your nervous system to tell your bladder to relax. It's not time yet. And you can use that if you suffer from incontinence as well. I'm glad to hear you're doing relaxation with me, Laura. That's great. I hope that answered your question. And then I see Man United Herbert has asked, What is the best way to decrease arm fat? I want to say that fat is really important. You have to have it in your body. And there's not any single exercise. If anybody tells you that you can do one thing to decrease fat in one part of your body, they're full of nonsense. There is no specific method to remove fat from any specific part of your body. I say embrace your fat. Fat's really good. Your hormones are made from your fat. But if you do feel that there's part of your body that you would like to work and enhance, then you can do exercises and you'll feel better and you'll feel healthier. But I would say try, if you can, to not worry about arm fat. Make your triceps and biceps stronger if you want to do chaturangas and, you know, pull-ups and different things. But don't worry about arm fat. It's not a thing to worry about. And there's not one single exercise that you can do. Okay, Melissa, you are so helpful. Oh, you're very welcome. I suffer with chronic constipation and IBS. Are there any exercises or some things I can do to help with this? Yes, when it comes to constipation, again, I started at the very beginning of this. I maybe have said it 10 times through this. Releasing tension from the system is going to help. Yoga Nidra, body scanning meditation, really good. Go through the body, find your tension, try to let it go. The pelvic floor relaxation exercises that stretch out the pelvic floor a little bit, they help a lot, because maybe you're aware that there is, it's called the anorectal angle. So there's a muscle, the puborectalis, that is kind of creating a kink in the rectum, and that if you don't take the kink out of the rectum, it can be hard to poop, because the poo has to go around a corner. Also the anal sphincter, if that's hypertonic, that's also going to make it harder to poo. So constipation sometimes is due to tension in those muscles. So these pelvic floor relaxation exercises will help them to maintain an optimal length tension relationship, which can make it a little bit easier for you to go. Now, the next thing is to actually remove the anal kink. You need to have about a 35-degree angle in the hips. So ideally, you will elevate your feet up a little bit. I mean, the natural position for defecation is a squat. So I have a couple of videos on the channel on how to poop and about how to make perfect poop. So the how to make a perfect poop video is about your food and how that changes the consistency of your poop, and the how to poop video is about getting the knees up. Now, if you don't have a step or some yoga blocks or something to put your feet on so that your knees come up a little, you can also lean the body forward a bit. That creates the angle in the hips that allow the puborectalis to release a little, so that you get basically a straight rectum, allowing the poop to come straight out instead of having to go around the corner. And the other thing when you're pooping is to, I sing. If you know, a lot of people with pelvic organ prolapse have to avoid constipation for dear life. I do. I have a pelvic organ prolapse, and if I get constipated, it's the only time I have any symptoms. So I do everything I can to avoid constipation. Now, when you start to go, it's very important when you get the sensation, even if it's a really mild sensation, it's very, very quiet, straight to the bathroom and allow yourself to defecate. Elevate the knees, and when you start, it can be, when you're constipated, if you suffer from constipation or IBS, or you have a pelvic organ prolapse, it can be very hard to actually relax the sphincter because of the fear. So I like to sing, and I like to create poop songs. So take a song that you know and change the words so that it's about poop. And that will make you relax and maybe giggle a little while you're going. But singing, it balances the intra-abdominal pressure so that you get a more consistent contraction. So the contraction of the smooth muscle that creates the defecation, the smooth muscle, it's called peristalsis, this smooth muscle contraction that goes in two directions. It like squeezes this way as well as contracting long ways to get the poop to come out. The sphincter needs to relax, the kink needs to be out of the rectum, and the intra-abdominal pressure needs to be balanced. So singing, really good. Michelle Conway, she does the moo where you to get the hips to open a little bit, and to get the belly to come out a little bit. And so you can moo on the toilet as well. That will help. But using sound is a really good way to go. And then, of course, IBS and constipation, what you eat really has a huge impact. So monitor what you eat, learn which foods are going to bind you up and trigger you. Don't have too much fiber, because that can also make big bulky stools that can be hard to pass, or not enough fiber. Try to find a happy balance. I hope that helps. Mary Monk question, can you do some videos on how to help interstitial cystitis? Yes, I can. I haven't actually done any, but I can. And then, you have mostly urgency. So for the urgency, I've talked already a little bit about getting the tension out of the system, doing the body scanning meditation so that you can feel tension in your body, do the work on any thoughts you have. Try as much as possible to stay away from stress, chemical, physical or emotional stress. Do the pelvic floor relaxation exercises to get everything to calm down, and then do those little contractions of the front part of your pelvic floor when you feel the urgency, but letting everything else relax. And that little front contraction relaxes the bladder and should help with the urgency, should help to tone down the urgency a little. And Mary, you have another question. If you're trying to force all the pee out of the bladder when you go to the bathroom, that will hurt the muscles in some way. So the bladder is a muscle. It's called the detrusor. It's a smooth muscle, and it is outside of voluntary control. You don't have to contract it. It will contract itself. If you are trying to force contraction, this can actually make the bladder less responsive, so it won't contract all on its own. And it can also create too much downward pressure, which can actually impact the ability of your pelvic floor muscles to respond to downward pressure. So when you go to the bathroom, you have to relax your pelvic floor, relax your belly, let the detrusor, the bladder muscle, actually do the contracting. And try, if you can, to let it empty, because it does create a dysfunctional neurological pattern if you're trying to empty by yourself. There are pelvic floor muscles that when at the end, when you've peed, your bladder has done all the squeezing, pees almost all the way out. There's a little bit left in the urethral pipe, and there is like a little bit of a contraction of the pelvic floor muscles to get those last few drops out, but it's not that you're physically trying to do all the emptying. So don't ever try to force it, make it faster. Sit there, chill out, just really relax and let it happen all by itself. I think that's the best advice I can give. I hope that helps. You're very welcome, Aoife. Thank you for the kind words, and thank you, Melissa. Any more questions? Where are we on time? 57. Did I answer all the questions from last week? I think so. Yeah, I think that's it. I think that's all the questions answered. If anybody has any questions that I didn't answer, I don't know if I missed any, or if there is something that wasn't clear, I will do another live again next Wednesday, 6 p.m. GMT. I'll schedule it now so that you can go in and turn on a little notification if you didn't get it. And I am in the process of recording some new videos. So if there is something that you would like to see, or I will do interstitial cystitis. It's not quite pelvic floor related, but it is at the same time. It's a little bit different, so which is why there aren't any videos on it there as of yet. But I will do one. But the thing to do, if you have any questions, drop a little message in the comments. If you haven't tried the Yoga Nidra, I put it up yesterday. It's really worth doing. Pelvic floor relaxation, it's really worth doing as well. And if you have pelvic organ prolapse or incontinence, don't shy away from releasing tension as your starting point. It's very, very important to get the body to function properly, to get everything to start doing its own job. We have to take tension away. And one last little trick that I will leave you all with. If you're in a really stressful situation, let's say somebody's shouting at you, let them shout, right? Let them have their little argument. bring your awareness into your body and see where you hold tension, because that is actually the key to finding in your body where you naturally hold in stressful situations. And what you'll do is you'll feel, oh, wait a minute, there's where I put my tension. And then you can start to let go of your tension. And in that stressful situation, you can do the breathing technique where you inhale for the count of 4 and exhale for the count of 8. Do about 10 rounds of that breathing cycle. And that will actually send a safety message to your nervous system and try to get everything to calm down a little bit. And then it's a little bit easier to drop that tension. But that's, I mean, invaluable when it comes to kind of losing the tension that is building up to create hypertonicity in your body. So any little stressful situation, or even if you're having like a stressful thought, just relax and see, okay, where am I holding this in my body? I think it was one of my most important lessons when I was going through my own pelvic floor journey. So remember also, talk about pelvic floor dysfunction. If we can talk about these things, then we can break the taboo and people don't have to suffer any longer in silence. Together, we can and will make a difference. And I wish you all a really lovely